Today we are looking at cervical cancer, and I'm grateful to the leadership for this opportunity to be with you. Some of the pictures you may see may be disturbing, but bear with us. The truth must be told so that we know the severity of the disease. And I'm also happy to see some young ladies at the back because it also concerns young ladies. If we take it right from the beginning, then we are good to go. Cervical cancer. It is usually confused with other diseases like endometriosis, leiomyositis, leiomyoma, and endometrial polyps. But to start with, when we say a cancer, we may have heard a disease that is caused by an uncontrolled division of abnormal cells. God, in his own wisdom, made cells. When we went to school, the basic science we learned, we talked about cells going into tissues, tissue into organ into organ systems. God in his own wisdom made all these. But it gets to a point in our bodies, influenced by certain factors, these become abnormal, the abnormal proliferation of them, and that constitutes what we call a cancer. So we'll look at it. Let the slides roll, please. So basically, I'll be looking at what it is, introduction, why we should know about it, how does it happen at all, and then is there a way to prevent or treat it? That's the outline. The next slide, please. So why do we need to know about this? Because it's killing us. It's a life-threatening disease. Worldwide, it's been found that cancers that lead our women to early graves, it comes as the number 4. If you take away breast cancer, which we are most aware, I'm sure, colorectal cancer, cancer that affects the anus and the rectum, cancer that affects the lungs, the one that comes worldwide is cervical cancer. But then, when you drill down to Ghana and other African countries, including Africa, South Africa and Kenya, it comes as second to breast cancer. So for us, it's the second most deadly cancerous disease. And why is it so? Every year, about 500,000 women acquire this disease, and out of it, about 300 dying of it. And if you take the four cancers, the cervical cancer alone contributes about 7% of this death. And that should frighten us that indeed is causing a havoc. It has a peak period in a woman's life by mean age of 54. But then we have what we call a bimodal. It happens in 2 stages, in 2 years. We have the 35 to 39 where it can happen, and then we have 60 to 64 when it can also happen. And in most of our gynae issues, as we said, 60% reported to us about cervical cancer. So let's learn a little of our anatomy, what we are made up of. God, in his own wisdom, down there in our pelvis, we have what we call our reproductive system. So we know a woman every month ovulates, has a menses, and then a cycle continues. If you meet a man, then procreation most likely to start. So down there you have your ovaries, you have the fallopian tube, you have your what we call the womb, the uterus. Then we have just the continuing of the uterus is what we call the cervix. That we call the cervix. So if you take the microphone I'm holding, the green part is more, the bulky part is more of the uterus, and this long part is the cervix. So the cervix is about 4 cm in length. We are not talking about the vagina. We're talking about the cervix for now. In that, it's about 4 cm, and the diameter, how wide, is 3 cm. Before you have the vagina and then the vulva and other exterior parts of the woman's reproductive system. Some relations, this cervix, God has so cushioned it in between 2 organs. In front of it is your bladder, where your urine is stored and comes out when you are pressed. Then behind it is your fecal, or as we may put it, bowel organs. So the side to it, you have the uterus, you have the uterine, the supply to this, that makes it function. The arteries, the veins, the nervations, what make you feel whatever happens in your body. All these are surrounding the uterus and your cervix. So why the need, or why does it happen at all? It's been found out that reported cases of cervical cancer or cancers, the organism that is picked up is what we call the human papilloma virus. And your basic science, you learned about bacteria, you learned about fungi, you learned about viruses, you learned about a number of them. So virus that causes cervical cancer, over the years, research has found out that one particular one is the human papilloma virus. And that has a number of types, in fact, about 40 of them, that can cause disturbance down there. But of interest to us is two of them. We call the type 16 and 18. Then 6 and 11 can also give you some funny appearance down there from time to time. So that is what we're looking at going forward. Now, what can predispose us to it? How do I get it? Research has found out that if you begin early coitus or intercourse, or to put it blatantly, sex, before 16 years, you are likely to attract or get into this issue of cervical cancer. If you have a number of sexual partners, more than 6, if you smoke 12 years, you are still smoking, you are prone to it. Then those who have a number of male friends, male sexual partners, the male friend may pick it from another woman or may have it on himself and may transfer it. If you have had a previous cancer, if you have not been using protective contraceptives or such as condom, if you are immunosuppressed, any disease in your body that does not help your antibodies to fight diseases, if it's gone down, it's likely to predispose you to cervical cancer. There are others that are more genetic. If your cells tend to change a lot, cervical dysplasia, then as I said, modifying factors, things that you can easily change from or switch from. Cigarette, exposing yourself to radiation. That's why when women are pregnant, we try to avoid as much as possible X-rays. Intrauterine, diester, besteros, these are just steroids. We are so much into becoming beautiful. It's good, be beautiful for us. But then the steroids and things that are injected into us, God already has made in you what we call estrogens, which facilitates your monthly periodical menses and if you are not well rich in vitamin A, E, you are likely also to have cervical cancer. Move on, please. So with the above, what I've already said, it puts patients into 6 categories. Those that have given birth too much, we call a lot, multiparous. 3, 4, 5, 6, 7, 10 number of children. It is good. You are filling the head. That's what Scripture says. But in so doing, if it is not well controlled or done, it predisposes you to a number of them. And as I said, of the global 4 in sub-Saharan Africa or in the lower economic countries, or we call the developing countries, it comes as second. So it is known to be a class. Prostitutes, our Nigerian sisters and brothers will call it tomato sellers. Poor hygiene. If you don't keep down there clean, if you are polygamous, having a number of partners or wives and husbands, you're likely to have this. Next, please. Now let me dive a little bit into the normal anatomy there. The cervix that God made has some tissues which we call the epithelium. This tissue is what covers most organs, either outside or inside. And there are three kinds of it. We have what we call the squamous epithelium, we have cuboidal and columnar. Don't bother about the words, just take the facts. So these tissues are down there, the cervix, as you see, that 4 cm long. Every part has this tissue. But as a woman goes through periodic menstrual changes, they phase. We have the squamous, which is the inner. When you pick up the tissue there, it's made up of layers. So you have the inner layer, endocervical, which is squamous, towards the end, columnar. So as you go through your menses, with the influence of estrogen, it changes. The squamous comes to the front or the outer surface, and then over time it matures and gives way and goes back to normal like that. It's a cycle. So the junction between these two we call the squamous or squamocolumnar junction. It's of importance to us. I'll talk about it as we go along. Next slide. So that junction we call the transitional zone. Next slide, please. And it's influenced by age, hormones, and all other stuff that goes on in a woman. So the transitional zone, in this picture, you see on your left quadrant, upper quadrant, a normal cell. That is how the cervix should look, pale pink, nicely. But then if it gets cancerous or it starts changing the way God made it, then you see that transition going from low grade to high grade, and eventually, right upper quadrant, you get what we call the cancerous or the cancer cells. This is what I explained earlier. In the cervix, that long, the 4 cm, where you see the deep red, I have 2 yellow points, the new, and then the original. So as you go through your cycle, the original one comes out, and a new one is formed behind, and it creates a transitional zone. As you go through your menses and everything works fine, it reverses, and then you get back to your normal in that order. So how does it occur at all, getting the cells to be cancerous? As explained, the cervix swells up in your menses or in the puberty and reproductive period and enlarges. The endocervical cancer elongates under the influence of estrogen. This leads to the infection I already explained. The columnar comes, and then the squamous give away. So with time, it occurs or it matures. At that stage, we call what we call atropium. The next slide to see the picture. This is what happens. This is not bad. It is a period where you are going through the puberty or the menstrual cycle. So the inner columnar is coming out to enrich, and then with time, it goes back. So if you look at the outer part, which is plain or clean, it is a squamous, the one that's originally there. You saw in the earlier picture, neat. But these ones come in forward or ecto in front for us to see, then it goes back. So when it starts pictorially, if we see a woman, this is how it begins. You begin to see a very reddish point. That's the introitus, that's the entrance of the cervix. You start seeing these signs. But the outer is the original, how it looks. But as it starts changing, you see this. So it continues in that fashion, and the squamous cell epithelia matures, but it's influenced by what we call glycogen. In science, we learned about sugar going through processes. You take in carbohydrate, fats, and oil, they are converted into all that, and it's stored in your body. A number of them, or multiple of them, can affect how this squamous epithelia behaves in your body. And we call the changes that is happening metaplasia. It's a change, a transition that is happening. The cells are changing its shape. The squamous are more like oval in shape, You have the cuboidal, which are more square, and then the columnar, like columns. They are more productive. They produce secretions that enriches the cervix. So as this transition is happening, one turns from the cuboidal shape to the other in that order. So we call that period metaplasia. Now, the significance of this is that we have learned that whilst this process is going on, when you come to the hospital and we want to screen you, because of the richness of the glucogen, we're able to do some tests, what we call glucose tests, to tell what is happening there. So it's a screening tool for us. God has made it in that sense, but scientists have captured on it to tell what is happening. We'll get to screening, and then we'll learn more about it. I've spoken about this. We can move on. Let's go on. Yeah. So this picture is showing the pictorial changes. The one at your far left is your normal cervix, no change. Then as the puberty or the menses setting, you have the changes, mild dysplasia going to moderate and severe. But if all this happens and is unable to reverse to normal and is influenced by external factors, then it moves into a situation where we have the tumor cells. External factors, i.e. the human papillomavirus getting there and taking advantage of it. The lower picture is showing how bad it can be. It can just be inside the cells, but when you see the boundary, a thin black layer beneath all the cells, I mentioned about oval shape. If you look at the normal oval, then towards the down, you have more like circle or square. It changes as the periods go by. But if it gets worse and it doesn't reverse, then it starts invading. Invading means it starts going into other cells. I started by saying the anatomy, God has made it. It has placed it between the bowel and the bladder. The cervix is in between these two, and it's surrounded by vessels that's innervated, the vessels that helps it to work. If it goes beyond the boundaries of just the cervix and it starts affecting other organs by it, we call it is invading other organs. This is what I just spoke about. A mechanism of carcinogenesis is when it's infected by HPV. But then if it gets cleared, if you look at the third point, clearance of HPV, then it regresses to pre-malignant status. If it doesn't, then it progresses to pre-cancer, then into cancerous stage. Let's move on. So how do we get to resolve or prevent this? Anyone that comes to the hospital will try to do what was screening. We have cytology, we have pap smear, we have colposcopy, and then we have HPV DNA tests. They are just terms to frighten you, but they are not. So cytology, we just take a part of the fluid, we'll let you lie down, give you all the respect due you, in the presence of a nurse, a friend, another health practitioner. Then we'll take part of the fluid or the changes that is going on in the cervix that we call pap smear. You might have heard of it. We take that part, and there's the pictorial showing that. We either use a brush or a spatula. Just take a portion of that and we send for cytology, for them to look into it and see, are there changes in the cells that are there? Have they moved from the normal to any abnormal cells? So this is an example of it being done for a woman, a part being scraped to send for cytology pap smear. These are a bit high level. When we have done that, we should be able to classify them into which one is low, of moderate, of severe. With that, you're able to apply treatment that meets its to rate. So it is the grading of the pap smear when it is done. You can move on. So when I mentioned about the glucogen that is part of the metaplasia state. When it comes to the hospital and want to do an immediate or a quick test, we apply acetic acid at the cervix end. And if it changes, it gives us an indication that something is going on. This one says negative, means after the application of the acetic acid, it stays the same, meaning it's a natural, it's in its original state, nothing has happened. But you see a positive one means some changes has happened, some cancerous cells have started its work there. With all that put together, we classify them into mild, moderate, severe. There are another classification. We have the Bethesda system, we have the CINN system. But all that we want to know that there are 3 classes of them, and then we treat as we go along. Let's move on. So what is the treatment? You come to the hospital, either after the assessment or screening. If it has not traveled and it's just localized, we can do what we call a large loop excision. We just take that portion, that cell that has gone abnormal, we take it away. Or we can take a whole chunk, or we can do, in worst case, if it's still localized at the uterus, it has not gone beyond the uterus, we do what we call the hysterectomy, where if you are finished giving birth, you subscribe to taking your uterus, we do that to prevent you from it going into other organs. So when you present and we are screening you for cancer, cervical cancer, your doctor will want to know certain things, and that will tell him or her whether it's an early or it's a late sign. You may go with your doctor and say, "Doc, I'm seeing thin, watery, blood-stained vaginal discharge. Every month, at the end of menses, I still see some liquid or some discharge, some fluid coming there. Or after your menses, you are still bleeding. Some have prolonged, some even in between menses, they are still bleeding. Some after sexual intercourse, there's bleeding. Some for our part of the world, by 45, 55, we expect a woman to start ending the menstrual period, going to what we call the menopause. So we have perimenopausal and postmenopausal. In those periods, we don't expect you to bleed or have menses. But you come and say, "Doc, I'm in my late 40s, I'm in my early 50s, I'm towards 60, but I'm bleeding." It's a flag for us to check and see what could be going on. If you come and yours is such that you have pain every time and it has gone into edema. Edema means swelling of your lower part, mostly your limbs, the back, your lower back, that's your waist, all the way there, or sometimes the vulva is all swelling. It tells us it's a late sign. It's gone beyond. Late in the sense that the cancerous cells have traveled beyond the uterus and now they have invaded the other organs, and in so doing, they are not allowing the flow of blood back into the heart for it to be pumped. So it stays in your lower part and causes what we call the edema. Yours may be a urinary or rectal symptoms, frequent urination, or unable to hold. Some may have painful urination called dysuria or hematuria, urinating, or you have bloody urine, hematuria, rectal bleeding. He goes to the private and sees blood in it. Or in some cases, it's constipation because it has occluded some vessels. You're not having a free bowel. When this happens, what gives us an indication of either 3 things happening, whether we have the growth happening inside the cells, the 4 cm, 3 cm diameter size, is either inner, in that sense we say endo, ecto in the outside, or it's a turn into an ulcer, a sore, a wound, what we know. And when it's exophilic or outside, you see something like a cauliflower shape or filling up the vagina. So this is an example of exophilic. If you start seeing something like this, then it's giving us a late sign. Endophilic is happening inside. So when you touch, it's deep, that place feels hard. Then in some cases, it becomes even like a sore, like a wound. In terms of signs, we put them as squamous cell carcinoma. I mentioned squamous, cuboidal, so that gives us an idea. Or adenocarcinoma, which is usually less and doesn't cause much of a problem to our women. Diagnosis, you come, we screen you. But the most disturbing part of it is that when it happens, initially, it is asymptomatic. What we mean by it is that it doesn't show any sign or symptoms. You don't have any feel down there or in your body to show that something wrong is going. Unless you start seeing the early symptoms I mentioned, postcoital bleeding, prolonged bleeding, and all that. When you come, we do examination, and most of our examination was called passing speculum. I showed in the earlier slide, putting a small tool under you, and it opens up for us to see what has happened at the entrance of the uterus. In some cases, we've seen in the earlier slide that it can cause constipation, meaning it has traveled beyond. So we dip our fingers into your back and see, are we able to penetrate to a higher level to have a free movement, or is occluded? We are not able to assess. Is there any organ that is blocking this access? We do what we call a PR, per-rectal examination. Then we'll do our basic examination, basic labs. We'll take your blood sample, because these abnormal proliferation or abnormal division of cells, they take a lot of the blood, because it's maturing fast, it's multiplying very fast. So the little blood or the blood you have is all consuming it. So one sign that will give us is that you may become pale. And I will take sample and check your blood levels. We'll check your liver function. We'll check your renal function, your kidney functions. All this to tell us, are they working normally, or they have had some of the cancer cells having its way there. In some cases, we ask you to take a chest X-ray. If the cancer cells are moving to your lungs, we'll be able to tell from there. We may ask you to do abdominal examination or ultrasound. So go and take a scan of your abdomen. It will give us an idea whether it's a fibroid, a leiomyoma, or it's actually a cancer that is building up. What is really happening down there? And when it happens and is blocking your uterus and giving you urinary symptoms, it blocks what we call the ureters. When the kidneys, God has made it so that when the kidneys make the urine or sieves your blood, it comes through some two nice tubes called the ureters down into your bladder, where it stores. And when it's about 450, 500, you are unable to contain it again. It presses you have to go and release it. But when this access from peeing or from coming out is blocked, it starts filling up. It's like, even when you have a hose and water is running through and it starts blocking the end where you have free access, we'll have a build-up of it towards the end. And where is the loose end, it will start giving up or giving way. So the ureters will now start showing signs. We may have backache or what we call a flank ache, and when you come and we hit, we'll be able to tell what is really happening. So we check your hydroureters and all that to see that it hasn't gone that far. I mentioned that it's always confused with endometriosis, leiomyoma, and cervical polyps, which are all benign. Benign means that they don't travel beyond where they are. They are not malignant. They don't cause cancer. So if you're able to tell that it's none or it's not a cancer, that it may be one of these, and we apply medications, then you are free. Apart from that, what could it be? Earlier mentioned endometriosis. We can use ultrasound, hysteroscopy. We pass a light tube, and then we'll see all this. Either a polyp, something like a balloon sticking out there, we're able to tell, and then treat you accordingly. So when we have picked these cells through a pap smear, there's a period what we call staging. Staging, we take these to our labs, and then we analyze and see at what stage, what is the progression of the cancer cells. This helps us in treatment. So it is a necessary thing to do when it comes to us screening one for cancer. And we use a system called FIGO system. You don't need to know that, but just we are educating ourselves per the theme for today. And it's worse, and we know that it's cancerous, we may take a biopsy. A biopsy means we take a part of the tissue and take it to the lab. So when we have done the staging, we classify into about 4 stages: stage 1, stage 2, stage 3, stage 4. Stage 1 means it is still localized at the cervix. Stage 2, it is dropping to the upper part of the vagina and then the pelvis. Stage 3 is the pelvis, organs that are there. Stage 4 means it has gone beyond the borders and is into the liver, the lungs, and other parts of the body. So this picture may be far from where you see, but it gives us the stages. The first one is stage 1. Says that it is still about less than 4 cm in length and is limited to just the ectocervix, the entrance of the cervix. Stage 2, it is getting bigger and is more than 4 cm in terms of diameter. It's moving on. If you look at the next picture, which is the middle picture, it's bulging up. It's become bigger. Then stage 2A, 2B, it is going beyond its borders. If you look down there, something like a liver, stage 3B, it has gone to the pelvis. Then the picture that shows the human body is stage 4A and B. It has left the pelvis and it's now gone into other tissues, liver, lung, kidneys, wherever it finds its way, it goes. So the spread, how does it spread? It can be direct, just the adjacent tissues, it just moves there. Or it can go through your lymphatics. God has made such that when your body fights diseases and cleans your blood, it goes back into the system for cleansing and goes through a vessel of tissues called lymphs. So it goes through your lymphatics. If it doesn't do that, then it may go as dissemination through your blood, hematogenous way, into other tissues. So that's how it spreads. Either directly, it moves, it's just adjacent, it just jump one step and it's there. Or it enters a lymphatic system or enters your blood and goes other places. How am I doing with time? What's the treatment? Treatment options varies. We have surgical, radiotherapy, chemotherapy, a combination of all, and one is worse off, palliative. Palliative is end of life. So radiotherapy, we subject you to some radiotherapy, so either we put the iodine, a radioactive ingredient, into your system where the tissue is to go and absorb it, or we give you some medications, cisplatin and the rest, so that it will shrink it. When it shrinks, then we can go in and do a surgery, take it out. So we do a combination depending on the staging we have seen. So treatment, as you see, depends on how fit the person, because when we do your blood screen and all that, if you are not fit, your blood level is so low, we will not take you to theater. We will not do certain things for you. So how fit the person is to go through it. The age of the person, sometimes it's not worth it. Person is nearer. Why do you want to go and worry the person? Yeah. So we look at all that and say, can you just give her, just give her medication to subside the pain, and then till God calls him or her home. The type of lesion, the stage of the lesion, and of course, in our part of the world, whether you have it to do it. Resources, availability, or experience. Now we have the experience. Resources, a few, but a resource from the family's end sometimes limited because it's expensive. So when we find out the stage, depending on the stage, we have listed what treatment can be given. I won't bore you with them. If it's a stage 1, this is what we'll do. If it's a stage 2, this is what we'll take you through. If it's a stage 3, this is what will be done for you. If it's a stage, the surgical procedure, some detail I have given there, but of course you are not going to write the medical exams, right? Then you can move on, please. So surgery done, every surgery you must expect some complications. You may have hemorrhage, meaning you will bleed, but it can be contained. I've initially indicated that it's between some delicate organs, your bladder and your rectum. It can injure any of these. Bladder dysfunctioning, it can cause fistula. What we mean is that the outpouching, one tissue can grow out and enter the other, and it forms kind of a tube into. When we have to take off your uterus, and if it had descended to the superior part of your vagina, then it will shorten it for you. So it's not pleasant. But then if it's palliative, as I said, end of life, at this stage you don't want to bore the patient. All you are doing is a good nursing care, good pain medication, feed if you cannot feed by himself or herself, put a catheter, control the symptoms, give the person enough treat as he expects the call to go home. The prognosis is not too good for us. Depending on the stage, once again, if it's a stage 1, we've realized that 5 years survival, about 90% can reach that. If we diagnose you and say yours is a stage 1, it's limited in only the service, you can, Mau is there, he can perform wonders, I believe in it. But aside that, stage 1, meaning your life expectancy, you have 5 years to live, and 90% can reach that. Stage 2, 60 to 80% should target 5 years. Stage 3, where it's gone to the pelvics, about 50% should target a life up to 5 years. Stage 4, for 5 years, just about 3 out of 10. Now, how do we prevent it? In fact, to put it simple and short, if we can, reduce the risk. And the risk is about what I mentioned, early sex before 16 years. So that's why I was excited when I saw the young ladies in us. Multiple sexual partners and all that. If you have to give birth and your family, you are small, maybe you are the only child, plead with your husband, just decide on 2 or 3. Let the other people in the world also. So, reducing the risk, do a screening frequently so that we know what is happening there. Then we can mitigate proactively. Above that, we have vaccination, which I'm sure the next after this, I will plead with the leadership to try and get it done for our youngsters in the church and those who have not tasted the forbidden fruit yet. They can also have it. So in terms of vaccination, there are what we call Severus, Gardasil, but in the nutshell is that WHO, World Health Organization, and Center for Disease Control and Prevention have come out that every one below the age of 26 can get this vaccination, and 2 doses is enough to prevent cancer of the cervix. Next slide, please. So I have put it primary prevention, secondary prevention, and tertiary prevention. Primary, as much as possible, abstinence. Or if you cannot abstain, stick to one sexual partner or prevent it. Use contraception, condom. I hope Papa Sofo will not come and sack me from using the pulpit to be talking about these things. Papa, I'm sorry. So, primary-wise, you get a vaccine, 2 of it. I want to talk about secondary. When you have crossed 26, research has found that it's of no much benefit. But what can be done is that frequent screening done, pap smear, applying of the acetyl assist, visit the hospital, let's see you. 6 months, 1 year, at least, let doctor see you and screen. If it's a confirmed case, that's a tertiary, then diagnosis and treatment is meted out. The 6 treatment options I listed out, one can apply to your case. I wanted to leave this out so that we'll do questions, but these are some frequent asked questions. If you wouldn't mind, I'll pause for us to do question time. Then if it doesn't, we'll go through it. Alternatively, I can do this one, and if your question happens to be in this, then it's answered, and I'll move on. So frequently people ask, why is the HPV vaccine important? The answers are right there. As humans, and male and female, we have, it's human-to-human transmission, and we cannot avoid it. So far as we live as social beings, we will contact each other. Those who are sexually active are there. Late teens and early 20s, research has found out that those are the prime areas, prime ages. And there are 40 different types I mentioned earlier of this human papillomavirus. It's a high prevalence and it causes death. So we need to know, we need to have the vaccine. Which girls or women should receive HPV? Center for Disease Control and Prevention says that at best, age 11 or 12, for our young women, they should be given. Or if they can, 9 years, we should give them this vaccine. If we miss that, then between 13 and 26, they can still be given the shot. And 2 doses are advisable and can help in prevention of the virus. Will sexually active females benefit from vaccine? They are already active. But then the advice is that, I mentioned it's about 40 different. So the vaccine prevents against the 16 and 18 types, 6 and 11. They are all the others, 35, 56. So you can still give it in the hope that it will prevent all the others from being contracted. Next slide, please. Can pregnant women get the vaccine? It is not recommended because it's been found not to be of any good to the baby. So you wait and get a screen after. Should girls or women be screened for cervical cancer before vaccination? If you are below 26 and you are not active, there's no need. Just go and get a shot of the vaccine. Next, please. How effective is the vaccine? It targets the cervical cancer vaccine, which there are other vaccines, other cancers that affect the vulva, the vagina itself, the anus, and then oropharynx. I don't know, some people enjoy it when this part comes in. So it can also travel down there. So there are vaccines that help. So it is effective. And it's been known to prevent for 10 years. For 10 years, those who have taken it is still preventing them from getting it. What does the vaccine not protect against? Not all. We mentioned about 40, not all. And then the fact that it does not prevent STI, sexually transmitted infections. How safe is the vaccine? We have been assured that this vaccine is being used worldwide. And the Worldwide Food and Drugs Administration has certified it. Center for Disease Control and Prevention worldwide has also certified it. However, there are minor cases, reported cases of injection pain, like those who took the COVID-19 vaccine. When you take it, you get some reaction. So side pain, some fever, some nausea. It has those side effects. Why is the HPV vaccine only recommended for women through 26? I mentioned it earlier. It has been found not to be of any benefit after 26 years. But however, you can give it a shot since there are others, research still ongoing, that have not been prevented. It may prevent it for you. What about vaccinating boys and men? It can be given. The same age for men, boys, girls. It is advised that young boys can be given 2 doses of it. Let's live a healthy life. Let's avoid it. If you can abstain, abstain. Avoid alcohol, avoid smoking, eat well, regular exercise. Let's take good care of ourselves. Every woman is at risk of cervical cancer. So far as God has made and you go through puberty and reproductive, there is this change that goes on. The transition zone will come, and if it doesn't mature and goes back, infection, HPV, can predispose you to it. But it is preventable. You can get vaccinated, get screened, and then let's celebrate it. January is the cervical cancer month. Thank you very much. So if still there are some bothering questions, we can take them. Anything you didn't get clear or you want a little more explanation? Or you want to add to it?
Okay, so with the vaccination, you said 2 doses. What if you've taken only 1? What happens?
So there's a period within which you have to take the second dose. So it is advisable that you take the 2 so that you get a full cover. It's like the one we saw with the COVID-19. At the point, second dose, third dose, booster, and all of that. It's just to ensure that you have a full coverage to prevent it from happening. You mean when there's a break, then you can get screened and then take after. No need to go to start. Yeah. There's a hand at the back.
Please, where do we get
The vaccine.
the vaccine? Yeah.
So all our health centers have them. We have the public health units. When you contact them, Tema General, Kolebu, I think Sakumono Health, you will get it. Then there are also some private laboratories which are also into this. Then, as I said, the leadership can even also organize for such vaccination days to be carried out. They can come well said, like the way the vaccine COVID-19 was done, come around and give the shots. It's just that it's a little expensive, around 500, 600 Ghana cedis. But maybe as a group, you can negotiate for some rebate, yeah, I'm sure.
Okay, so please, if I'm 30 years and not sexually active, can I still take the vaccine?
Yes, you can still take, because that's the number 1 preventive stage, the primary preventive stage. Yes.
Please, I would like to know if a child takes it within the specified age group and then a child goes on to become sexually active, what is the risk? You know, you said the children from 9 years to 13, it's good for them to take the vaccination. Now, after the child has taken it, and then they become a little promiscuous, is it still preventing or it doesn't work?
Yeah, it works. The research so far says that 10 years and beyond, those who have been, the data collected says that it's still preventing. The vaccine still works. So they are not getting the cells getting abnormal and then proliferating. So far as it's had it, it prevents against it, even though it's gone into that, maybe other forms or other STIs may catch up, but which the vaccine does not prevent. But in terms of cervical cancer, it prevents.
So you talked about the first stage is second stage. So in case you go to the hospital and you are the second stage, what can be done? Is it removed, or is surgical removal, or medication? What happens if you are at that point?
Can you roll back the slide? So second stage, we are saying that it is in the uterus, but it is moved a little. It's towards the end of the slide. It's moved from the uterus towards the upper vagina. So when you go there, there are radiotherapy or chemoradiotherapy, and what I talked about, the coning or local excision. If it's just cancerous over a local portion, either radiotherapy or that cell can be taken out. Yeah. If you want to locate it, just about last but 5 slides.
Yeah, please, how expensive is the vaccine?
So when I last checked, they said it was around 500, but we organized some for our church women, and they were paying 600 for the 2 doses. So it was negotiated. But when you go to the health centers and they contact the public health, I think you may pay around 400, 500 for a dose.
Okay, please, I would like to ask again. I saw that with the pap smear, they put the instrument like that. And you said it is recommended for us to do that screening often.
Yes.
So every time they have to use the instrument like that before they can do this.
Yes, so it's like a woman pregnant. Every time you go to the hospital, and especially when you are due, you forgive the doctors. Our hand will go there. So we need to see what is happening there. For now, I'm sure there's technology out there where we just can introduce the colposcopy. That one just introduce a light source, and we see it on a screen. Yeah. But if we want to take a sample, then we need to make it wide, and with a brush or a spatula, take it. But we just want to see, we can just introduce a light source, and that will not be as painful as the instrument. But on a lighter note, the size of the speculum is like what we already know.
Please, is there any food that when you eat, it can help not to get?
Not really, but the whole idea is that you don't want to go into an immunosuppressed state, a state where your body cannot fight diseases anymore. So we say eat well and make sure your food is rich in vitamin A and E. These helps our bodies to fight the disease. And eat well so that you are strong, you have enough blood. Should it happen that you have to go through any minor procedure, your state of health will not be an obstacle. So of all the foods eating, at least make sure that vitamin A and E, but it doesn't prevent, it just bring your state to appreciable level so that any procedure can be done on you and your body can fight diseases. That's basically that.
Any more questions, please?
All right. Thank you so much once again for this opportunity, and God bless us all.
Thank you very much, Dr. Victor Asante.